This mellitus, also known as diabetes, is a disorder where the body does not produce any insulin or does not use it efficiently. So, this diabetes mellitus is a metabolic disease that causes high blood sugar. Also, this diabetes mellitus is a major public health concern in Malaysia. According to the National Health and Morbidity Survey 2019 by the Ministry of Health, the prevalence rate of diabetes in adults has increased from 13.4% to 18.4% in 2019. For a normal person, this insulin we go through the bloodstream and get into the insulin receptor, and then the glucose molecule in the bloodstream will go in through the cell membranes and it will use it as energy. So there's two types of diabetes mellitus: diabetes mellitus type 1 and diabetes mellitus type 2. Okay, so for diabetes mellitus type 1, usually develops during childhood but can develop at any age. So for diabetes mellitus type 1, it means your body is no longer able to produce insulin. So that means there's the pancreas will not produce any insulin, so the glucose will stuck here at the bloodstream and can get into the cell membranes. So for diabetes mellitus type 2, this diabetes can develop at any ages, but most common in adults over 40. The diabetes mellitus type 2 still produce insulin, but it doesn't make enough of it or it doesn't use it efficiently. So that means even though the insulin will get into the insulin receptor, the glucose can get into the cell membranes and it will stuck here at the bloodstream and it will causes high blood sugar and the person can get diabetes mellitus.
Assalamualaikum. I would like to present about diabetes mellitus. My part is about factors, symptom and diagnostic. I will start with factor. The first factor is age. The second one is family history. The third one is being overweight. In my opinion, not exercising regularly also can cause you being overweight. Other than that, race and ethnicity also can cause diabetes mellitus. Other factors that you have to know are pregnancy, high cholesterol, smoker, high blood pressure, and metabolic syndrome. The second task is symptom. The first symptom is the thirst and hunger will increase. The second one is your mouth will feel dry. You may do the urination frequent. Other than that, you will lose some of your weight. Other symptoms are weak or feeling tired, blurred vision, dry and itchy skin, cuts or bruises are slow to heal. The last one is urinary tract infection. How to know if you have diabetes mellitus or not? you can try go to the hospital and do some diagnostic tests. There is 5 diagnostic tests of diabetes. The first one is fasting blood sugar test. A simple plasma glucose measurement obtained after at least 8 hours of fasting. FBG has been the American Diabetes Association test of choice for diagnosis of both pre-diabetes and diabetes disease state. The second one is oral glucose tolerance test. OGTT has been one of the diagnostic tests of choice for the past 80 years. OGTT is recommended by WHO or WHO for diabetes diagnosis and is listed as an option in the ADA recommendation. The third one is capillary glucose. Capillary glucose is a popular method for determining point glucose measurement at the time of office visit. Other than that is random plasma glucose or RPG, a rapid anytime test with high specificity in symptomatic patients. The last one is HbA1c. HbA1c has developed into the standard measure and is now broadly used for both research and clinical purpose. HbA1c has been endorsed by the ADA as a first-line test for screening and diagnosis. That's all from me. Thank you.
Islamic solutions for diabetes. As we all know, every Muslims in the world are obligated to fast every day from dawn to sunset in the month of Ramadan. Therefore, we can take fasting as a solution for diabetes. Fasting may have some general health benefits. For example, it could cut down on inflammation, help with weight loss, and lower cholesterol. Fasting may improve the way your body manages glucose and cut down on insulin resistance. One very small study included 3 men who had diabetes for 10 to 35 years, and the men fasted every day or 3 days a week. Within a month, all of them were able to stop taking insulin. The effects of diabetes on your body. When you hear the word diabetes, your first thought is likely about high blood sugar. Blood sugar is an often underestimated component of your health. When it's out of whack over a long period of time, it could develop into diabetes. Diabetes affects your body's ability to produce or use insulin, a hormone that allows your body to turn glucose into energy. Here's what symptoms may occur to your body when diabetes takes effect. Here I want to explain 3 of them. First of all, kidney damage. Diabetes can also damage your kidneys and affect their ability to filter waste products from your blood. If the doctor detects elevated amounts of protein in your urine, it could be a sign that your kidneys aren't functioning properly. The next one is circulatory system. Diabetes raises your risk of developing high blood pressure, which puts further strain on your heart. When you have high blood glucose levels, this can contribute to the formation of fatty deposits in blood vessel walls. Over time, it can restrict blood and increase the risk of atherosclerosis or hardening of the blood vessels. Lastly, central nervous system. Diabetes causes diabetic neuropathy or damage to the nerve. This can affect your perception of heat, cold, and pain. It can also make you susceptible to injury. The chances that you won't notice this injury and let them develop into serious infections or conditions increases too.
A very good day to everyone. My name is DANIA, ALIA anak Kump HAMDAN from 4 STEM 1. Now, I will be talking about the link between diabetes and chemistry and also prevention tips and treatment for diabetes. Diabetes is a lifelong illness. There is no cure for diabetes. However, it's preventable. It can be controlled and treated. People with type 2 diabetes and pre-diabetes, which means your blood sugar levels are higher than normal but not high enough to be called diabetes, can restore their blood sugar levels to normal just by making lifestyle changes to prevent, delay, and treat diabetes-related complications. Diabetes is always linked to glucose and insulin. Both glucose and insulin are organic compounds. The molecular formula for glucose is C6H12O6. Meanwhile, metformin is an example of treatment for type 2 diabetes. The molecular formula for metformin is C4H11N5. The major goal of diabetes treatment is to keep your blood glucose close to normal, which can delay or prevent complications by balancing food intake with medications and activity. Having a healthy diet is important. Refined grains such as white bread and white rice contain simple sugar, which is easily absorbed, causing rapid rise in blood sugar, while whole grain products leads to slower increase in blood sugar and insulin to reduce the risk of diabetes complications. Foods that are high in fiber include vegetables and fruits. Fiber may help you to reduce the risk of diabetes by improving your blood sugar control and promoting weight loss by helping you feel full. Other than fiber, vegetables and fruit contains lots of vitamins and minerals which are essential for a balanced diet. Sugary fruit and grains are high in carbs. This could result in increase in blood sugar. Water is by far the most natural beverage you can drink. Drinking water instead of other beverages may help you control blood sugar and insulin levels. People who are diagnosed with diabetes or pre-diabetes should begin with changing the amount of food they are eating. This is called healthy plate method to keep carbohydrate in a safe portion. Avoiding large portion sizes can help reduce insulin and blood sugar levels and decrease the risk of diabetes. During exercise, our muscles use any excess sugar in the blood and the sugar known as glycogen that is stored in the muscles and liver. After exercise is completed, the muscle will gradually replenish their sugar stores by taking in sugar from the blood. This helps lower blood sugar levels and improves insulin sensitivity. Insulin is a hormone produced by the pancreas. Each person needs individualized treatment. Type 1 diabetes is managed with insulin as well as dietary changes and exercise. Type 2 diabetes may be managed with non-insulin medications, weight reduction, or dietary changes. When blood glucose levels cannot be controlled by diet, weight loss, exercise, and oral medications, type 2 diabetes may be managed with insulin. However, this treatment brings many side effects such as low blood sugar levels, which is hypoglycemia, weight gain, liver inflammation, and frequent urination.